So there was a question from my followers about endometriosis, scars, and uterus, removed.
Yes.
And what they can do about, because our online school will be teaching them how to self-treat.
Okay.
But the scars, they're so important, nobody talks about them. So, and all three aspects, endometriosis, laparoscopes,
right,
or removal of part of the body makes scars.
Okay, so there were three questions that you were asking. Is one, what does endometriosis do in the system, if I understand? And then another question about like surgery scars, is that what we're talking about? Including laparoscopic. And then the third question was what happens like after a hysterectomy and that kind of thing. Is that what I understand? Mm-hmm. Okay, so what we're going to be looking at in the online program is how the bony frame is working, how mobile it is, because again, you have the spine, the pelvis, and the legs that are hanging from the pelvis. So if there's any change in the pelvis permanently, that changes how the leg functions and it changes how the spine functions. All right. So when we're talking about scar tissue in particular, and to be honest, the endometriosis, all three of those things are actually almost one question. All right. So it's nice that they conveniently all came together because even though they're different dysfunctions or different diseases, they all happen the same way in the system, or not the same way, but scar tissue develops very similarly in the system. So when you have scar tissue that happens, we have to remember that every organ, and this is how I explain it to my clients, every organ is sitting in a Ziploc bag. All right, you'll have to give me the Slovenian interpretation, but in a Ziploc bag. And those Ziploc bags are hung from the frame. So when I'm talking about the frame, I'm talking about the bones of the pelvis, the bones of the spine, and the bones of the rib cage to hold everything in place. And so organs are in very particular spaces in the pelvis and in the abdomen. Okay, so when you develop something like endometriosis, what happens is that endometrium comes in and it goes to different tissues and basically acts like super glue through all these different layers. So sometimes an organ, when it's inflamed, so even with something like a bladder infection, or even with something like a cough or a sneeze, or something that you get like a stomach infection, so those cause inflammation in the system. And so in the baggies, the organs can get stuck to the bags on the inside, or the organ can get stuck to the side of the wall. So say over to one side. And scar tissue is normal. It is supposed to happen. It's how the body protects itself. And if you're thinking about taking apart a piece of the chicken, it's that white stuff that's in there, and that's the fascia that's attaching all of this. But what happens is that scar tissue goes through layer after layer after layer in different directions. This is why every patient is different, or every client is different. And so our job as therapists is to help them determine where are the organs placed in general, and what's moving and what's not moving. So what we're going to look at in the online program is, what do these contents feel like when they should move? And they should be soft and springy. There really shouldn't be much pain in here. And I don't want to scare clients, is if they do have pain in there, it doesn't mean something's wrong. It can just mean it's in tension. It's a mechanical problem, not a visceral problem. Does that make sense? Mm-hmm. And so what we're looking at is, what is the direction of the scar tissue? So say you have the bladder here, the uterus, the rectum. What happens is they might get stuck to this wall. And so you can palpate as a client in this area, oh, it's tight in that direction. And if I move my legs to one side, or I move my legs to the other, or I flatten my back against the table, you're, as a client, going to be able to feel where that restriction is. And you'd be surprised how soft it gets, how quickly. And that's what we're going to show in the online program. The other thing is, so the organs can get stuck to each other. They can get stuck to a wall. And so learning how to mobilize that, even on just a global level, not even seeing a physical therapist, can make a huge change in this. And then all of the scarring that happens with surgery. So if you've had intestinal surgery, a gallbladder removal, if you've had hysterectomy, any of those things, then you might have that scar tissue developing all through there. And scar tissue, if you look it up online, goes all over the place, and it doesn't go in one direction. It's not like it just tapes to the side and it stays there. And so those different layers might get stuck together. So instead of sliding and gliding, now it only moves this much. And so over time, our body is protecting those organs, which is why the joints often break down in the long run. If that makes sense.
A lot of sense.
Do you have any questions in there?
Yeah, because sometimes even gluten intolerance, Crohn's disease,
all the
diseases regarding the gut.
Yeah, so all that inflammation. So exactly, remember the patient that we had yesterday, she had a long-standing history of endometriosis as a young adult, 1920s. And then over time has developed all this gut inflammation. Now, I think they're very much related, because I think a lot of the scar tissue that she has developed from her endometriosis kept her guts from moving like they're supposed to, her intestines, from moving like they're supposed to, and got bound down in that. And I think that's what's causing her bowel obstructions. But if we go in there and mobilize the belly and get all those intestines moving correctly, I think she'll have a totally different outcome. I think we'll change her life.
And we are talking about constipation or diarrhea.
Yes, right? Yes, because the body has to adapt one way or the other. It has to get that out. So it's either going to make you have diarrhea or it's going to make you have constipation. So that is very common. Now, to address the third question, do you think we adequately addressed the scar tissue and
It's perfect.
Okay, perfect. So the third question was about like a hysterectomy and things that come out. So it's going to sound funny, but the casing of the organ gets taken out, but the ligaments and everything that held it in place are actually still in the body. And so when they remove the organ itself, the place where it used to exist and the things that used to hang it there are still there. All right. So often what happens is the reason you get a hysterectomy, sometimes it's hormonal, but sometimes it's pain and bleeding and a lot of other things, which, by the way, can be influenced by the mechanics. Again, it can be it. So if, for example, the uterus is stuck over here for whatever reason, birth. I mean, so pregnancy, all of these organs move to different places, and sometimes they don't exactly go back where they were because there was a space occupying object in there. All right. So being able to get that more mobile after pregnancy is a fantastic way. So sometimes what happens with that hysterectomy is you remove the organ out there, but say it was restricted on this left side, that ligament is still restricted in the body. And so you can go in and mobilize that and make huge changes on a patient's pain level. That's because of, as we're talking about Halloween, the ghost of the organ that's still in there, if that makes sense. And everything has to adjust to now this organ's not there anymore and it was a supporting structure. So now everything has to rearrange. And if it doesn't have the mobility it should, it can't take its place, its new setting very easily. It might be restricted. So if you have a lot of inflammation in your gut and you've developed scar tissue over a long period of time and you take the uterus out, now the abdomen can't drop down to take up that space. And sometimes that pull and tension can be felt in the system. So really your online program really looks at how to mobilize that, how to get that involved in movement, and how to restore more normal movement to the system for a better outcome, better feeling, less inflammation, and more mobility. And those scars that people have, that have had forever, need to also be mobile.
Yes, we will especially
And
do the
so you need to learn how to mobilize that scar, even if it's been there for 40, 50, 60, 70 years.
appendix.
Oh,
Some of the things people usually forget. I never had a surgery.
Oh,
But
yeah,
they
with a laparoscopic surgery? I know. They say, oh, I've never had a surgery. And their belly button is like stuck to one side. And that's where you can really tell, actually, if you have restrictions in there. One of the really easy ways to tell is to stand up and look in a mirror. And if your belly button is off to one side, you have restrictions in the system somewhere.
And this program
Surgery or not. And that takes care of it.
And that's why we will learn how to do it on ourselves.
Right. But taking it back to the frame, the reason why we care is all this soft stuff in here has to be mobile. So for example, if it's restricted down and pulling in, it does that to the pelvis. And now the pelvis is stuck in this position. And so if you can imagine, you see where this hip is sitting. If that pelvis is like this, that's totally changing how this hip is working. And look, the frame is crooked. And so now you're working at it this way, and look at what it's doing to the whole spine.
And that's when the pain in sacroiliac joint can occur.
Oh, absolutely.
And the problem is not here.
Right.
The problem is here.
Yep.
Thank you.
All right. Hope that answers that question. So we're off to Crater Lake.
See you in the online school.